welcome to my presentation. Now we are going to discuss about one interesting topic is forceps delivery. So giving childbirth is very crucial and very precious moment in our life. If that is getting obstructed, if the progress is not taking up well, means we need to deliver the baby with the help of customized instrument, that is forceps. With the help of forceps we can deliver the baby in a good manner. I am Pramila, completed MSc Nursing. I am working as an assistant professor in ES College of Nursing. Yes. So what is that forceps delivery means? It is a form of assisted delivery that can help mothers deliver their babies vaginally when labor is not progressing well. Yes, if the labor is not progressing well, means with the help of forceps we can able to grasp the head of the fetus, then we can deliver the baby vaginally. It helps to prevent maximum incidence of cesarean sections. Like this. So what is the definition of this means? Obstetric forceps is a double-bladed metal instrument. It is a double-bladed metal instrument used for extraction of the fetal head. So with the help of this metal instrument we can extract the fetal head from the mother. Types. What are all the types present means? Long curved obstetric forceps, Ringley's forceps, Keeland forceps, Piper's forceps, Barton's forceps. Based on the station of the head, we need to select the type of the forceps. So what is the action? What the forceps are going to do means, first is traction. So with the help of forceps we can able to traction. That means we need to pull the baby from the pelvis. And then rotation. Forceps also helps in rotation of the fetal head. So in deep transverse arrest, persistent occipito-posterior and mento-posterior position, this can helpful. And indications. So first indication is prolonged second stage of labor. So what is that second stage of labor means? It begins with full cervical dilatation and ends with delivery of the child. Yes. The duration for this is for multi 2 hours and for primi So indications of this forceps delivery is prolonged second stage of labor. Here what is that second stage of labor means? It begins with full cervical dilatation, that is measures about 10 centimeter, and then ends with delivery of the baby. So here the duration for primi, that is first delivery the mother is undergoing, means that will takes place 2 hours. And for multi, that is the mother was given already one birth, means 30 minutes. So here due to what may be the prolonged second stage means inertia. What is that inertia? The uterus can't able to produce adequate amount of uterine contraction, inability to contract of the uterus, and poor voluntary bearing down effort. And then large fetus, if the baby is large means that can't able to come out. And then rigid perineum, if the perineum is very rigid means that can't able to flexible and will not come out the baby in a proper way. So in that situation also we need forceps. And then malposition. What is that position means? Where the bony fixed point of the fetus lies in the 1/8 circle of the pelvis. So where the bony fixed point is lies means that is the position. So what is the normal position means? Occipito anterior is the normal position. If the occiput lies lateral or posterior means that is termed as malposition. So here persistent occipito-posterior and deep transverse arrest will lead to cause forceps delivery. And then maternal indications. Maternal indications, what are all the conditions means? First is exhaustion. The mother is very exhausted, distressed with the voluntary movement. that means the mother can't able to provide adequate amount of bearing down effort. Mother was so tired. And pulse is more than 100 beats per minute. Yes, mother is ultimately in the distress means, exhaustion means, that will lead to cause increased pulse rate. And then temperature is more than 38 degrees Celsius, and signs of dehydration. So these are all the signs that is the mother is in distress. And then maternal disease such as heart disease, pulmonary TB, and pre-eclampsia. These mothers also can't able to produce adequate amount of bearing down effort. Fetal indications. So in the fetal indications, fetal distress. So in the maternal indication, mother is distress. Here also the baby is distress means there is no fetal effort. So that will lead to cause prolonged second stage of labor. And prolapsed pulsating cord. So if the cord is the presenting means, cord presentation means, when the membrane ruptured, the cord will be prolapsed. So prolapsed cord will lead to cause occlusion. If the occlusion happens means there is inadequate blood supply to the fetus. So that will lead to cause distress. And then preterm delivery. So preterm delivery, after that, after coming head in breech delivery. If the breech presentation is there, the whole the body and the extremities will be came off. But the head is in large size, no, so that the head is not able to come out. In that situation, we should use forceps. And then during cesarean section, 1 or 2 blades may be used to extract the head through the uterine incision. Yeah. So why these maternal and fetal conditions are very important means, for the successful delivery through vaginally means we need 5 P's very important. That is, first P is power, that is uterine contraction. Second P is passage, that is birth canal. So pelvis need to be adequate and the cervical dilatation effacement need to be taken. And then third P is passenger. Passenger means fetus. So fetal effort is very important. Fourth P is position of the baby's head. And then fifth P is psychological status of the mother. So these are all the 5 P's very important for successful completion of vaginal delivery. If anything getting altered in these 5 P's means, absolutely that will lead to cause dystocia, that is difficult labor. And then, so what are the types of forceps when we need to use, that we can discuss here. Yeah. So in the outlet forceps, the fetal head is at the perineum. The fetal head is at the perineum means that time we need to use outlet forceps. The scalp is visible at the introitus, that is vaginal orifice, without separating the labia, that is crowning is present means that time we need to use the outlet forceps. So here also sagittal suture is in antero-posterior diameter, right or left occipital diameter or posterior, and here rotation does not exceed 45 degree. Yeah. And the low forceps, what is that low forceps means? The leading point of the skull is at the station of +2 or more and divided into I rotation, that is less than or equal to, that is first rotation, less than or equal to 45 degree, and the second rotation is more than 45 degree. So what is that +2 station means? That is ischial spine is the 0 station. If the 2 centimeter below from the ischial spine means that is +2 station. So in that situation we can use low forceps. And mid forceps means, so here the head is engaged but the leading point is above the +2 station. So engagement was happened but that is not reached and gone above the ischial spine means that time we can use mid forceps. And high forceps mean not included in the classification. Yeah, it is abundant in favor of cesarean section. So here there is no engagement of the fetal head. The fetal head is engaged means only we can proceed with normal vaginal delivery, or if it is arrested means we can go with forceps or vacuum delivery. If there is no engagement means surely we need to refer the mother for cesarean section. Pre-requisitions, what are all the things we need to be considered before the application of forceps? That is remembered with forceps mnemonic. So F stands for fetus alive. Yeah, if you are handling or we are going to plan a forceps delivery means vaginal delivery also, the fetus need to be alive. Why? Because we need that 5 P's important. Fetal power is very important, and also we need to complete the normal delivery process without any complication to the mother and the baby. So fetus is to be alive. And then O stands for os dilated. Here os is cervical dilatation. So cervix need to be fully dilated, that is 10 centimeter the cervix need to be dilated. And R stands for ruptured membranes. Yes, automatically the ruptured membrane happened means only the baby can come out from the uterine sac. Yes, so ruptured membrane is very important, and also rotation need to be taken place. So fetal head need to be in the anteroposterior diameter, that is sagittal suture. And then C stands for cervix taken up. What is that cervix taken up means? Effacement of the cervix, that is thinning of the cervix need to be happened. And then E stands for engagement. Already we discussed before, engagement need to be happened, then only we can go with normal delivery, that means forceps delivery. And then P stands for presentation suitable. What is that presentation suitable? The anterior position need to be there. And S stands for sagittal suture in anteroposterior diameter of the inlet. These are all the requisitions we need to consider before application of the forceps. And then steps, we need to recall the steps in a to J order. Yes. So first step is A. What is that A means? Ask for help. Yeah, we need to handle the emergency situation always with the help of others. We can't able to manage by single hand. Yeah, so first we need to address the woman, explain the procedure and ask for consent. Without consent of the mother, we can't do anything. We should not do anything. Yes, and adequate anesthesia we need to give. Yes. And B stands for bladder empty. So bladder need to be emptied. Yes, if the bladder is full means the fetal part can't able to descend. So full bladder, one of the research study was proven that full bladder will help to keep away from the 2 centimeter of the diameter. Next is B. So B stands for bladder empty. So empty bladder is very important for descending of the fetal head. So full bladder will help to keep away from the 2 centimeter of the engaging part. So we need to empty the bladder always. It helps to promote the descending of the fetus and maybe catheterize the bladder. Then C stands for cervix fully dilated. If the cervix is not fully dilated means baby can't able to come out. So the full cervical dilatation is very important, and we need to examine for the full cervical dilatation. After that, D stands for determine the position. So position is very important. Here position means position of the fetal head. The anterior fontanelle is larger and forms a cross. Yes, and then the posterior fontanelle is smaller and forms a Y. Yeah, and assess for bending the ear. Okay, then remember molding of the head makes assessment difficult. Yes, okay, then we need to assess the molding of the fetal head. Think about dystocia. So what is the dystocia? Difficult labor. Normal labor is otherwise known as eutocia. So this means difficult. Difficult labor is the fetus going to fit through the pelvis. So whether the baby will fit or not, that we need to consider. Next letter is E. Equipment ready. So we need to ready with all the necessary equipment. Third, first is, do you have help? Yeah, we are having the help. And then, do you have resuscitation equipment ready? Yes, if it is any crisis occurs, if it is any critical situation occurs means we need to manage the mother and the baby with resuscitation equipment. For that we need to keep ready with that. And what is going to happen if this does not work? So for that, if the failure of forceps delivery means we need to always keep ready with cesarean section, that is informed ready with the operation theatre. And F, that is forceps applied. Then here we need to apply the forceps. So for the application of the forceps, we can see in the next slide, and in order to check they are in correct position, think position for safety. Yeah, the position of the forceps is very important. If the articulation of the forceps is not happened well means we can't able to provide traction and rotation of the fetal head. So the fixing of the forceps is very important. And here, so forceps application is this sixth step. Yeah, we are seeing articulate the forceps and hold them in position. So before application into the introitus, we need to articulate the forceps externally. Then we need to disarticulate. Place left blade in the left hand. Yeah, we need to place the left hand. That means we are going to apply in the left side of the mother. No, that blade we need to keep in the left hand of us. And then apply to the left side of the mother's pelvis. Then cephalic curve towards the vulva. So towards the vulva means towards the external genitalia we need to insert. And shank vertical at start. So shank need to be in a vertical position. So in a vertical to medial we need to insert, and then apply to the left side of the fetal head. Yes. And then right hand protects maternal tissue, applies force. Why need to protect the maternal tissue? That need to be prevented with the injuries. And repeat for right. So what are all the steps we are carried out in the left side, we need to repeat in the right side also. After that, right side blade application, we need to articulate handles and lock the handles together very easily. Yeah. And then posterior fontanel midway between shanks, and then 1 centimeter above plane of shanks. So what is that shank? Shank is the space from the lock to the toe of the blade. Yes. So this is the shank. This space is to be 1 centimeter away from the fontanel. So fontanel here, the baby's head is present here. That is the posterior fontanel midway between the shanks. And fenestration admits no more than 1 fingertip. So fenestration means here one window is present to release the stress in the fetal head. So after application of the forceps into the fetal head, there is no more than 1 fingertip need to be administered. And sutures posteriorly fontanel above and equidistant from upper surface of each blade. Sagittal suture is within the midline. Yeah. So sagittal suture we need to maintain in the midline. Why? Because means there is presentation of the fontanel is there. No, in order to protect that, always the sagittal suture in the midline. And next is 7th step, gentle traction. So here we are completed the application of the forceps. So yes, if the application is getting failed with the articulation is not happened properly means we need to de-articulate and then repeat the same procedure. That is, insertion of the blade need to be taken place once again. If the articulation happens means we need to give gentle traction. So gentle traction in a downward outward direction, like J-shaped curve we need to give. In that curve only we need to give gentle traction. And this may be performed during or after contractions. Always we need to give traction during the contraction or after the contraction. Yeah. And handles, that is handles drawn up in a J-shaped curve. Yes, we need to handle the that means we need to use the handle in a J-shaped curve. Okay. And then incision. So here incision means episiotomy needs to be considered when the fetal head is being delivered. So why we need to give episiotomy? For the adequate space in the perineum. In order to promote the delivery of the fetal head, we need to give episiotomy. And then J. J means jaw. So here forceps are removed in the opposite order they were placed in when the jaw is visible. So we are given the traction movement. So that the baby was come out from the pelvic cavity. So how we can confirm the head is delivered means once the jawline are visible means we need to stop the traction. Why? Because the head was born fully. Then we need to dearticulate the forceps and proceed with the normal delivery. So what are the potential injuries may cause during the forceps delivery? First, crush injuries. What is that crush injuries? With the movement, we are giving force with the help of forceps, no, that will lead to cause some injuries to the mother and the baby also. And lacerations, because of the friction movement, laceration may take place. And swelling, friction will lead to cause some injury, so that will lead to cause swelling. And bruising means discoloration of the skin. And then increased jaundice may takes place because of the bleeding, and anemia also, intracranial hemorrhage also will takes place. And what are all the advantages and disadvantages of this? Means advantages does not require maternal effort. Yeah, we are giving the force externally, so that there is no requirement of maternal effort, and so is preferable when you may not want the woman to push. Yes. So maternal cardiac disease, if the mother is affected with maternal cardiac disease, that time we can use the forceps delivery. And maybe quicker, we can able to shorten the duration, and also possibly less fetal injury if used correctly. Yes, we are articulating the forceps in a proper way means we can able to prevent the fetal injuries also. Yes. And disadvantages of this means this is may cause significant maternal genital tract trauma if good practice is not displayed. So practice is very, very important. If we are not practiced well means that will lead to cause genital tract trauma. And clinicians need increased training and need to display greater skill, dexterity and experience. So dexterity means the knowledge required for the skill application. So skill, knowledge and experience is very, very important for successful forceps application and the delivery. So this is what the anatomy of forceps. So this is blade. So this curve is blade. So this blade is considered to be as foot, means this is toe and here is the heel. After that, the part which touches with the head is cephalic curve, that is fetal head, and then the part which is occupies or touches the pelvic floor is pelvic curve, and then heel is there as okay, and the shank is present between the toe and the lock. Yeah, and then that is need to be very parallel, then only the locking process will takes place good. And finger guide. So this finger guide is helpful for the gripping of the forceps, and this is hole, that is a handle, and then here hole is present in the blade, that is fenestration, that helps to release the overpressure here, so that we can able to prevent further injuries. And then this is pelvic curve. Yeah, okay. So finally, totally 10 steps in the forceps application. So in English, these are easily remembered with A to J steps. So this was given by the also, that is Advanced Life Support in Obstetrics organization. Yes. So recap of this forceps delivery, why we are using forceps delivery. If the maternal effort is absent, the baby is can't able to come out from the pelvic cavity, means we can use the forceps, that is metal object is used to grasp the fetal head and provide traction to deliver the fetal head. Yeah, there is 10 steps, that is from A to J we need to follow, and before the application of the forceps we need to look for the prerequisitions, for that is mnemonic of forceps we need to follow. Yeah, thank you. I hope the class useful for you.